Danny Mortimer is Chief Executive of the NHS Confederation, which represents health bosses. Morning, Danny.
Good morning, Stig.
We hear and have heard, even outside of a pandemic, of the NHS being in crisis, there being insufficient capacity. So we might be too inured to this idea of a problem. How bad is the problem as you see it at the moment?
So yes, Stig, I mean, every year for many, many years now, this time of year, January in particular is a time of enormous pressure for the NHS right across the piece, from people working in the community to people working in hospitals. The thing I would say that is unique about this, and in some ways, language fails us. This is no longer a crisis. This is something truly exceptional. A year ago, the NHS had about 4,000 critical care beds, the beds where we treat our very sickest patients, for adults, that is. Before the weekend, we had about 5,500 of those beds. So we've opened another 1,500 of those beds as a result of the pandemic. And there will be another several hundred of those beds opening today. So that's a sign of both the numbers of people that are coming through, but how really, really ill, how much care and attention, how much help with their breathing, how much damage is being done to people's internal organs, because we're having to give people the very highest levels of care that we are able to, albeit we're asking our staff, our doctors and our nurses and others to actually care for more patients while they're doing that, because of course we don't have any more critical care trained staff than we did a year ago.
And so how far could you take this if it's 5,500? Can you keep going? Can you keep adding more and more extra intensive care beds? And then who loses out if you do that?
I mean, organisations have had these surge plans in place, and we saw over the Christmas New Year period many more of these beds being opened in all sorts of different places within hospitals. I think one of the most remarkable things is that our teams have kept going throughout that period, and they refuse to see a point where they aren't prepared to keep on going anymore. I think this next week we will be at the limit of what we probably have the physical space and the people to safely do. And of course, this is the week when we expect also the highest rate of admissions, the highest demand for the care that we're providing. We've already seen significant impact, significant disruption on other services that we provide. I think the vast majority of places now around the country have had to cancel some level of planned activity. And that's because the critical care capacity isn't available, or because we've had to divert physical facilities or staff away from theatres and surgical activity to help care for the pandemic. We've seen significant disruption to ambulance services in terms of wait times. We've seen enormous disruption to the care that people are receiving in the community and from their GPs, because, of course, a lot of people with COVID are out in the community and there's a demand being placed there. And yet, as Sir Simon Stevens described over the weekend, the vaccination programme is getting through phenomenal numbers of people, and we will have passed 4 million people vaccinated now. And we are starting, obviously, to invite for the vaccinations the next level of higher risk groups, people over 17, people with underlying serious underlying health conditions. So, enormous disruption, but also, one of the strongest progresses in the world in terms of the vaccination programme at the same time too. I mean, the teams working in the NHS, I've worked with them now for 30 odd years, Stig. I mean, it is truly remarkable, pretty humbling, actually, what people are managing to achieve at the moment.
And we know that we were talking about this morning. There's a potentially devastating effect on their well-being. These people who are working longer hours, they're working in areas they're not actually trained to work. If they're going into ICU, they're having to learn on the job. Yeah. They're seeing death and devastation. They're wearing masks and PPE all hours of the day. They're feeling this is not going to go away anytime soon. All of those things make for a potential staffing crisis, mental health wise.
Yeah, and look, people are exhausted. They've been working at this intensity now for a long time, and our job is to keep an eye on them now. But I think our job as a country as we head into the spring is to accept that our people will need a little bit of headspace. We will need to have a little bit of debrief time. We've got lots of people who've given up their annual leave, given up time with their families to come in and work alongside their colleagues, whether that's on the vaccination programme or in hospitals, wherever it may be. So there will be something in the spring where we allow people to take a bit of time to recover. And part of the problem we have at the moment, Stig, is that the underlying gap in terms of our staffing, particularly in nursing, but in other professions as well, has been there for a number of years now. And what we say on behalf of the NHS is that the government has to come up with a plan for the longer term, which gives our staff, those people we've just talked about, hope that actually the gaps in their rotas, the gaps in their teams will be filled in the longer term. There are no quick fixes. It takes a while to educate a healthcare professional, but we need that long-term plan, and that strikes us as a really, really important response to the experience of the pandemic, a really, really important message to give our people, given how very hard and exhausted they are now, how very hard they're working and how exhausted they are right now.
Daniel, also good to speak to you this morning, Chief Executive of the NHS Confederation, saying that there really are no words to explain the scale of the crisis in the NHS this time in terms of pressure on beds and staff.